Thank you, brother. Our next guest speaker, I am going to read his bio because it's one of the most fascinating bios that I've ever read. Domingo Garcia is an American attorney and politician from Texas, a lifelong civil rights activist, loving father of 2 children, husband to Dr. Elba Garcia, Dallas County Commissioner. He was elected to the Dallas City Council in 1991 and served until 1995. He was elected mayor pro tem of Dallas in 1993 and became the first Latino to hold that post. He served in the Texas House of Representatives for 3 terms. He was the co-author of the HB 1403, the Texas In-State Tuition Act, that's the Texas Dream Act, the first in the country that allowed undocumented Texas high school students to go to college. He was a candidate for the 2012 elections. He almost won that race. He opted not to run for Congress in 2014. He's now the national president of the League of United Latin American Citizens, LULAC. As the leader of the oldest and largest organization for Hispanics, Domingo Garcia wants to raise LULAC's profile and membership as it works to increase voting rights and help migrants crossing the border. He believes fighting for others so they too have the opportunity to achieve the American dream. At age 33, Domingo became the youngest member of the Dallas City Council. He was elected to the Texas House Representatives in 1996. And he's absolutely, in my opinion, one of the most important leaders in this nation. And Domingo, we really want to hear what you have to say about Hispanics, the community, how they're being impacted by COVID-19, and anything that you think we need to do legislatively to, protect and treat the people in the Hispanic community. Thank you, Domingo.
Yeah. Joe, thanks for having me. I really appreciate it. Like I said, I'd like to talk to everybody a little bit about what's going on. And for those of you who are not familiar with LULAC, and we are the largest Latino organization, civil rights organization in the United States. We're also the oldest, founded in 1929. We're sort of our cousins are the NAACP. So we're 91 years young, and we started as fighting against all the injustices that we were seeing primarily in the Southwest. So for example, in the case of Westminster versus Mendez versus Westminster, we ended and fought to end segregated schools in California. Many of you who are from the East Coast may not know, Mexican Americans were segregated just like African Americans. And our case went to the Supreme Court first, and the U.S. Supreme Court outlawed separate but equal back then. And then Brown versus Topeka was voted on the next year, which is a lot more famous case. So we continued fighting and making sure that we issue and deal with problems. And our number three priorities are education, making sure that all our children are educated and moved up. We have a young population. Average Latino is 24 years old. Economic empowerment, they're the backbones. Whether it's the mom and pop shops, the construction companies, all of them are looking to see how we can move forward. And this crisis has hit them very hard. And we're trying to see, and we're talking about how we can change this. The healthcare system. We have a caste system, an apartheid system of healthcare right now in the United States. And what the coronavirus has shown is that those at the bottom, and Latinos are the least insured of any ethnic group in the United States, are having to scramble to try to get basic care done, and that's having tragic consequences occur across our country. Civic engagement, getting Latinos to go vote. Latino voters are coming out, especially our millennial voters, and they are going to have an impact in this election. And we saw the election of AOC in New York, 2 Latinas in Texas. Those numbers continue to increase. We're also dealing with immigration. A lot of you probably think Latinos are only dealing with immigration. That's one part of our equation, and an important part, but we are dealing with the fact that over 13 million immigrants in this country are undocumented and underserved and not served at all by our governments. And then criminal justice. Latinos are disproportionately targeted by law enforcement. And many Latinos are incarcerated primarily for drug and alcohol offenses. And that's going to be part of our mission statement, is to reform the criminal justice system. The COVID-19 impact on the Latino community has been substantial. We're getting complaints from across the country over what is happening. I don't know how many of you know, but 800,000 Latinos are in healthcare. They're primarily in the nursing and healthcare system, as well as doctors, and they are on the front lines of dealing with this, especially in New York, in Chicago, and down in South Florida where the crisis appears to be heightening. Uh, some interesting stats. The workers that the Republican Party thought were not should never get a raise up to $15 an hour are now considered essential workers. These are the farm workers who are putting the vegetables on our tables. These are the meatpacking plants. Latinos who are also working for less than $10 an hour without adequate protection, but they are now frontline troops, keeping the food going to our grocery stores and keeping America fed throughout this crisis. This picture was taken in Marshalltown, Iowa last week by one of our LULAC members. Look at these people have to go to work. They're told, if you don't come to work, you don't get paid. There is no sick pay. There is no unemployment for all these workers. And at this particular plant, they have already had 22 people tested positive, and they've had to close it down because of the impact that this is having, because they basically have no social distancing. And until recently, we're not being provided any type of protection, whether masks or gloves. And these are meatpacking. Well, this is a scene from Sunset, Florida. Yesterday in San Antonio, Texas, 6,000 people lined up at a food bank because Latinos rely on basically no safety nets and are having to depend on charitable and religious groups to try to get them through this crisis. Next one. Latinos are by extension extended families. It's very common to have grandma, grandpa, aunt, and uncle living with a husband and wife and a couple of kids. We have extended families, and this is extremely dangerous because if anybody gets sick, they're going to get the whole family sick, and that's something that is going to impact our family disproportionately. These are just a couple of the we filed a complaint with OSHA last week that we wanted OSHA to start enforcing the safety orders that come from the Center for Disease Control at meatpacking plants, poultry plants, agricultural areas where Latinos are on the front lines but are not being protected, and it is threatening our food supplies as they come through. Next. So LULAC is asking that the government start collecting ethnic data. Why is that important? Latinos live in larger households. It's not uncommon to have anywhere from 4 to 10 people living in one household. We have poor access to healthcare, but yet we are providing essential services, whether that's picking up your garbage, whether that's providing the food that goes to your table, whether that's working the construction sites, and so on and on and on. Yet they're not getting any kind of health care. And we also have underlying problems like the African American community, diabetes, high blood pressure. So all those secondary symptoms that we're seeing in the African American community as they are disproportionately impacted is now hitting the Latino community. And I'm just going to give you an option. When they tell Latinos stay home, not very many Latinos can stay home. They can't work from home. They are doing manual labor. They are on the front lines having to do work person to person, and that's impacting us. Next. Let me give you an example. This is what we're seeing from what we got in New York City. You've seen those horrific numbers, almost 800 people dying. Latinos are the largest group that are dying right now in New York City. If you look at that, 22 out of every 100,000 people are Latino deaths. African Americans are 19.8. White is 10, Asian is 8.4. So Latinos and blacks are dying at twice the rate of white people right now in New York City. Next. But let me show you how this segregation works. This is a map of New York City. Look at the outlines there where you're seeing the highest outbreaks of the coronavirus by zip code. Now on the right side, look, it's Queens and the Bronx, which are majority Latino and African American communities. And they're the ones that are getting hit because they have to take the subway. They have to take public transportation. They have no cars. And they cannot afford Uber or Lyft. And therefore, they are disproportionately impacted. And you're seeing that in the death tolls that we're seeing across America. Next. So right now, the Latino, I'm going to go from New York to Florida. In southern Florida right now, this is in Hialeah, Florida, which is about 90-something% Latinos. We're the largest Latino towns in Florida, just south of Miami. On March 22nd, there were 9 cases of coronavirus. On March 31st, 243. April 5th, 507. April 8th, 597. And I want to tell you why. In Florida, to get your unemployment, think about all those people working on Carnival Cruise Lines, Disney, you have to go in person. This was the line on March 31st. People waited for hours next to each other to literally fill out a unemployment form, and they got sick. Thousands got sick waiting in line, okay? And the Florida unemployment system was rigged so that people wouldn't file for unemployment. They made it as hard as possible to get unemployment. And you know what you can get for unemployment in Florida? $257 a week. That's what these people are lined up for, okay? And as a result, now Latino populations are being severely impacted by this. The disparities have grown to a large extent and continue to do so. That's why LULAC's plan of action is Latinos need to be included in any testing pool for vaccines. Why? Anglos and African Americans are type A and B blood. Latinos are type O, we're majority Native Americans. And therefore, we need to make sure whatever vaccine works also applies to the Latino populations in the United States, over 60 million people. Latinos should also have access to emergency sick pay, expanded unemployment insurance, and equal access to testing. Right now, we're not. Whole swaths of the employment sector where Latinos work are not included in sick pay or unemployment. Example, farm workers, the ones that are picking the crops, they get no unemployment. If they get sick for 14 days in quarantine, they get nothing, okay? They were specifically excluded, and a large portion of them are undocumented. So they are, again, get zero, even if their children are US citizens. Congress needs to make sure that we pass in writing that all men and women, including Latinos, and regardless of immigration status, get benefits. Because let me tell you, the coronavirus doesn't ask for your papers. They don't ask for your immigration status. And that is going to have an impact, because if you think that right now you're fighting for toilet paper and paper towels at the grocery store is a big deal, wait till you're fighting for the last steak, the last piece of chicken at that grocery store, okay? Then that's going to be dramatic. We have to take care of our children. Right now, almost all the school districts in America are closed down. Many of our children depend on that breakfast and that lunch at school for them to be taken care of. And right now, many school districts are not providing that. We need to make sure that those meals are being provided to these families and these children. We also need to make sure that our children, many of them don't have laptops. They don't have iPads. They cannot be homeschooled. And if we got to make sure that the tech companies provide the computers, the laptops, the iPads, so that the kids can get their lessons. And then even if they got the iPads, most families don't have Wi-Fi. They don't pay for Wi-Fi. That's a luxury. Okay, so we need to make sure that AT&T and Spectrum and all those companies step up, or the government says, you know what, we're going to make Wi-Fi free for everybody in the United States so that the kids can access and not fall behind in their schoolwork. The issue regarding our labor force, 49%, this is as of last week, this is before the 6.7 million of this week, 49% of Latinos have had their jobs lost, they've been laid off or furloughed, or they had a pay cut. Of all our population. By comparison, only 33% of non-Latinos have been laid off or had a pay cut. That's a 60% differential. That's huge. The LULAC is supporting that agricultural workers keep on pushing OSHA to implement safety programs, that we're expanding our unemployment benefits to all these people and their families. Continue. Next. Economic survival, I told you about this. Besides the health crisis, the economic impact on our community is huge. Most Latinos have small businesses, whether it's a taqueria or a bridal and quinceañera dresses, and these men and women depend on that income, and they're on a month-to-month basis. And if they don't get immediate help, and the stimulus appears not to be giving anybody help, I have yet to hear of only one person who asked for help and got $15,000. And I have seen no others so far. And so that pipeline is just not getting to people, and businesses are going out of business and may not survive. One of my bankers said, you know, Domingo, I feel bad for a lot of these Jose's and Marias who have businesses. They did everything right. They paid their taxes. They took care of their workers. They paid their bills. And through no fault of their own, they're not going to make it. They're just not going to make it. And then they're going to be put back into the bottom of the labor pool, and we're already just trying to get out. We need Congress to pass an SBA disaster relief program that is adequate to deal with these folks. We need Congress to adopt minimum wage funding and stipulated how much funds should go to minority-owned businesses. Right now, the paycheck support plan doesn't say, let's put aside 30% for African American Latino businesses. It just says it's all out there, and Denny's is applying, major hotels are applying for this, and they're competing again with these small mom and pop shops, and that's just not fair. We have to set aside to deal with these small businesses. Finally, the detained and the imprisoned, not a popular subject. Most polls show most immigrants, support. Most Americans want to build a wall and all that, and Trump's really good about blaming the Chinese or blaming the Mexicans or blaming the Muslims, blaming the other, the scapegoating, the piñata hitting, administration. And what we need to do here is we need to look at asking ICE to immediately release all the immigrants that are nonviolent, especially those with humanitarian concerns, over than 50, pregnant, children. We still have children's jails in America. Thousands of children are in jail. These detention camps can become death camps. And Chicago, at their correctional institution there, now several hundred prisoners have tested positive. Same thing is happening in immigration camps where prisoners are being tested positive as well as their guards. And again, there's not going to be adequate health care at a lot of these locations. They barely have it now. And if there's an outbreak of several hundred of them getting sick, that can result in unnecessary deaths. And we ask him that all ICE enforcement and deportation stop in order to stay in place and take care of these individuals. Access to health insurance. Latinos are the largest uninsured ethnic group in America. In Texas, we're the largest. The governor of Texas said they didn't want Obamacare. So we need to make sure that any action by everybody who has access to Congress or the Senate, that we need to make sure that we expand either Medicare for all, or we look at some type of process to get Obamacare to be more inclusive and make sure states include everybody in those programs, and as well as the whole high cost of insulin, for example. Many people in the Latino community have diabetes. You're paying $500 per month if you have insurance, and if you don't, that family's having to decide, do I pay the rent or do I get the insulin for my daughter so she lives? These are terrible moral choices that are having to be done every day. We want a moratorium on mortgage, rent, student loans, and foreclosures without penalties. It's very important. For Latinos, their home, like most Americans, is their biggest investment. And many of them have been paying 10, 15 years on that home. And for them to lose it because they lost their job or they got furloughed or they got a pay cut would be devastating, just like it is. And we're looking at 2008 all over again. So we need to make sure that we have changes. I'm going to end with this because I think I took too long. I apologize, Joel. But during the last Great Depression, it took that depression to get a transformative mindset in Congress. And that's when you got Social Security. That's when you got unemployment. That's when you got benefits to those that were disabled. And I think maybe we have a window here to ask for transformative politics that deal with the inequities, with the apartheid systems, both economically and in healthcare, that is based to a large extent on race, and deal with those head on. And if we have something that equalizes the playing field for everybody by raising wages, providing economic opportunities for entrepreneurs, getting healthcare for all, that's what we need. And that's what I'm asking for with your help and support. Muchísimas gracias. I look forward to working with all of y'all. Joe, thank you for having me.
No, muchas gracias, de nada. I didn't think you went too long. I wish you could have gone longer, Domingo. That was a phenomenal presentation. I want to urge everybody, if you have a question or a comment to Domingo or in general, just put it in the chat box. Domingo, before we go on to our next featured guest, Meredith Dobson Results, just would like to ask you two questions. The first question is there a pathway for undocumented Hispanics to become residents or citizens with all deliberate speed so they can pay their rent, receive stimulus checks, and be protected from COVID-19 in terms of public health, access to healthcare, and an economic safety net? I think this is also, as you have mentioned, this is the opportunity to move forward on a path to citizenship, which I feel like both parties have dropped. Your response?
Well, as you know, Trump is still running on immigration as number one topic. While this may have taken it off, he'll go back on it and is going to blame, some poor little immigrant. There's a lot less coronavirus cases south of the border than in the United States. We're like the epicenter right now in the world. But that's still that scapegoating, I think, is going to continue, and that's going to prevent anything from going forward. But we do believe that, again, there's a window that if they see that, the grocery shelves go empty because all those immigrant workers get sick, or they strike at the meatpacking plants, at the poultry plants, on the fields in Arizona and in California, then that might jolt the Republican leadership to say, you know what, we got to legalize these 13 million immigrants. They're essential workers. They're an essential part of America, and let's fix it. But right now, there's no political will on the Republican side of the aisle. The Democrats are ready to do a deal. The Republicans are not.
So would you suggest legislation that would be introduced as a pathway for people to become legal residents? That would probably be more politically expedient or realistic.
Yeah, the Republicans are totally scared of the Latino vote, and that's why the citizenship, they stopped citizenship classes and swearing ins. And we're talking about hundreds of thousands of new potential American voters. And what I've heard from certain sectors of the Republican leadership will agree to provide these immigrants with legal resident status, but they can't become citizens and they can't vote. And sometimes you need to take half a loaf instead of the full loaf. So we're still open to we're talking on those issues.
Okay, and then last question, Domingo, what can organizations and concerned Americans on this call do to support LULAC's initiatives to ensure that the Hispanic community is treated with fairness and dignity? But also, as I noticed with your excellent presentation, I have not seen any commentator on MSNBC or CNN local news bring up Hispanics whatsoever. So how do we change this?
I mean, look, if you watch CNN, MSNBC, Fox News, it's basically a bunch of white folks talking about the issue, even though Latinos and African Americans are the ones that are dying and are being impacted. But when you see the president and his team, you don't even see the Surgeon General, who's African American, on that face behind Pence and him. So that's a problem. We are sort of the invisible economic engine of America, but we're not seen that way, and we got to just continue banging on the door until it opens, both at the media level as well as in Congress and the Senate. And I think we're going to have some success, but it's going to take some time. And I'm really concerned about voter suppression, by the way. I think that this election in November, we've seen that the Republicans, you saw what they did in Wisconsin just last week. In Texas, it's illegal for me in Dallas to go register people to vote in Houston, Texas, because I don't live in the same county. And before I can register people to vote, I got to get a license to be a deputy voter registrar, and I got to take a 3-hour class, and that's only good for 1 year. So the system's always rigged by Republicans trying to disenfranchise voters. And so I'm concerned about that in terms of the future.
Well, I just want to say that on August the 5th and 6th in Charlotte, North Carolina, there's a national summit protecting our vote. It was supposed to be scheduled a few weeks ago. Domingo, you're one of the keynote speakers of that summit, and that is where we're bringing together over 300 people, organizations, Jesse Jackson, Barbara Onwine, to come up with a national grassroots and grasstop strategy to crush voter suppression and voter purging. My mother just got a letter in the mail today saying she wasn't registered in Florida. She's absolutely registered. So voter suppression and voter purging, that's going to be the strategy of the Republican Party to win, and that's to steal elections. So if people want to get in touch with you, Domingo, if they have any further questions, how can they get in contact with you? Because there's a lot of people on this call. I'm looking at the chat room. It's blowing up. They want to be able to have more dialogue with you and LULAC.
You go to LULAC.org, and what can they do to help? I mean, like anything, or any nonprofit organization, we rely on funding, on donations. We're a membership organization. We're all volunteers. I'm a volunteer. We have a small paid staff in Washington, D.C., but we're in 42 states. We have several 100,000 members who pay a small membership fee of $20, and donations are important. And I would like to invite Dr. Sachs, I think, to work with him and the other members of the organization. I think we can really create a dynamic, progressive movement that can transform America in a way that hasn't happened since the New Deal under Franklin Roosevelt. And unfortunately, it's taken a crisis like this, a pandemic like this, but I always look for a silver lining in every crisis.
Yo estoy de acuerdo contigo. I agree with you. And we're going to continue these calls, Domingo, not just only through the duration of COVID-19, we're going to be doing it afterwards so we can maintain this 21st Century Rainbow Coalition for Social Justice. So incredible presentation. Also want to thank your staff for doing a great job in a very short period of time. That presentation was A+, and I think there'll be organizations like PDA or People Demanding Action. If it's okay, we'd like to be able to share your presentation when we do other national town hall meetings.
Be glad to.
Okay, thank you very much. Our